Hi guys. I know it's been a while since I did not meet you on our class. So right now I'm gonna do a video class where you can just watch it and then listen to. So I know I missed two classes already. So right now I'm trying to do a video learning class so we can catch up, okay? So I think we have finished the chapter 2. Now we were gonna going to do and tackle about the chapter 3, which is collecting objective data, the physical examination. Okay? So right here I have the screen and my face also, so you can see me talking. Okay, just bear with me. So we will be talking about collecting objective data, the physical examination. Do you remember Mrs. Gutierrez? Yeah, that's her. Remember her case from the previous chapter that we have? We know that Mrs. Gutierrez is having like a what this before when she went to the clinic. You did some few assessment, you did the interview, and then you know that Mrs. Gutierrez was not yet ready to do you know the assessment that time because of the certain situation that happened to her and her husband that had an accident, so she was not yet ready to do the health teaching. That's why we do the interview, so we can know, we can learn when will the patient or the client will be ready for health education. So right now, after establishing a beginning working relationship with Mrs. Gutierrez, last time in chapter 2 we did the interview and how to do the interview with the client with we discussed about how to do interview with clients with anxiety, a client who's seductive, client who is mad or angry. So we already talked about it, and you also answered it on your exam recently last time. Okay, so now we're gonna go on chapter 3, which we're gonna do the physical assessment. Okay, so we have Mrs. Gutierrez. Mrs. Gutierrez, we already have collected some information about her. So we know, according to those interview and the assessment that we gather, Mrs. Gutierrez need to have physical assessment. So this additional data will help us to determine Mrs. Gutierrez nursing diagnosis. So if she needs some referral to a primary caregiver, if it's needed. Okay, so now we have this to become an expert on how to do the physical assessment, you the nurse or you must have basic knowledge in 3 areas. So it's already here actually. So all the things that I'm gonna tackle is just on the book. Okay, types and operation, in the PDF. Type and operation of equipment needed for a particular examination. So it depends on what physical examination you're gonna do. So you have to know what types and the preparation that you need, any equipment that you need for a particular examination. And also you have to prepare the setting for oneself and the client for the physical assessment. So physical assessment must not be done like in public or what. You have to provide clients privacy. It depends on the physical examination, and it depends on the area where you are working with. So a little curtain will do, a little space will do, in which you can provide privacy. Performance of the 4 assessment techniques, so we will be using that. So we will be using inspection, palpation, percussion, and auscultation. Okay, for the equipment, so each part of the physical examination requires specific equipment. So we have here on the next next page of the PDF, where the list of equipment necessary for each examination that you need. So it's on the other page, so you will see how it used, how you can in which examination it is. Is it in for the skin? Is it for the vital signs? So you will see. Okay, so now, of course, the nurse should gather all the equipment needed for the physical assessment to use with Mrs. Gutierrez. So, for example, your client is Mrs. Gutierrez, okay? So, you have to prepare for the examination. How you prepare the physical setting yourself and the client can also affect the quality of the data you elicit, okay? So, an examiner, you must make sure that you prepared all the equipment. Kasi syempre, ang hirap naman, di mo pala prepare, babalik ka pa doon, tapos may iwan mo si client. So, it's not good. Paano pag fall risk pala si patient? Or seizure prec? So, di mo pwede rin iwan basta yung pasyente. Kaya, it's really good that you are already organized before doing the physical assessment. All the necessary equipment was there and was already prepared, para maging proficient ka. So, how to prepare the physical setting? So, we have here the physical examination may take place in variety of settings. So, it depends. You can be in the hospital room, in a patient clinic. It depends where you work. Or in physician's office, school health office, employee health office, or a client's home. So, it depends. But the most important thing, the nurse should strive to ensure that the examination setting meets the following criteria. So, we have here some conditions that at least the physical setting should have. So, it should be like comfortable, warm room temperature. You have to provide a warm blanket if the room temperature cannot be adjusted. So, if it's cold, then you provide some warm blanket. If it's hot, you can provide some fan to make comfortable with the client. Or private area, free of interruptions, like you have to close the door, or if there's a curtain, you can pull it up, you can pull it down, or you can pull it slightly, like syempre kaya may sarado. Quiet area, like free of distraction, so you should have like turn off the radio, the television, or the other noisy equipment. So we already finished with the physical settings. Now we're gonna do the equipment needed for the physical examination. So here on the list, we have first, for all examination that you will do, you should have at least the gloves or the gown. So you can wear it, and also the client can also wear the gown. Right now, because of the COVID-19 pandemic, a face mask and a face shield is a must. Okay? So it's also a protection for the examiner and the examinee that we don't know that you may contact with blood, body fluids, secretions, excretions, and contaminated items, or any disease that can cause, disease-causing agents, like bacteria, virus, or germs from the client. So you should also have to protect yourself. For vital signs examination, this is the very common equipment that you use. You already knew it, I know for sure. So we have the sphygmomanometer to measure the diastolic and systolic blood pressure. Stethoscope. Stethoscope is really like the main equipment that you should really need, and I'm really encouraging you to invest to a very very good quality stethoscope, because you will gonna need it until you work in the hospital or any settings or any clinic that you will be when you become a registered nurse. This one is a very important part of any assessment. Okay, so you can use stethoscope to auscultate blood sounds when measuring blood pressure. This is for the vital signs. Okay, thermometer. So right now, thermometer, you can find it everywhere, in the mall and in any area, like in the security guard. They will just it's like they're gonna do like this to you, and then they can measure your temperature. But the most effective one and the most accurate one will be the thing that we put here on the ear. What I call it, we have it in the hospital, the probe, the thermoscan. We call it thermoscan. We put it here on the, you just have to change the plastic probe, and then you put it here on client's ear, so you can measure the right temperature of the patient. So we usually do, if the patient had like a fever, or like a bit, malapit na magka-fever, like 37.7, and then we have to make sure if it's a fever or not, because we usually our measurement of the fever is usually 37.8 and above. So, para sure tayo, minsan talagang dalawang tenga yung sinusukat namin. So, we have here the thermometer. Different kinds of thermometer here. This is what I'm calling you the probe. Right? That one, the plastic one. The plastic small thing. Like that. That's what you call the probe. Which you put it on the thermoscan. And then, you put it on the client's ear. So, para at least medyo malinis. Tatanggalin mo yung it's disposable. We usually change it every day. Oral, rectal, tympanic to measure body temperature. So, it depends on the hospital what they do provide. But, for us, it's more accurate from the ear. I mean, you measure it from the ear. So, also, it's important to have a watch. Actually, I don't have a watch right now. So, or almost right now, everyone has like an, what do you call this? An iWatch or anything like electric watch. But we prefer to have like a second-hand time. Second-hand time. Like time or time watch. Yeah. Kasi mas maganda talaga. Minsan kapag yung patient mo, especially if you have a patient who have like, alam mo yun, yung parang bradycardic. Or sometimes naman, yung parang merong mga atrial fibrillation, no? Kaya may mga problema sa puso. Kakaiba yung kakaiba yung kanilang tibok ng puso. Hindi siya katulad ng normal na lab, dab, lab, dab. Hindi siya ganun. So, importante na i-measure natin siya like manually or using your step na ilagay mo sa kanilang left side para i-hear yung heartbeat nila. Kasi makikita mo talaga dun na, ba't ganun yung tulog niya, parang may iba, may parang, basta hindi siya yung katulad ng normal na tempo, like lab, dab, lab, dab. Sa kanya iba. Minsan nag-skip, minsan nag-ano. So, yan, ma-appreciate mo yan pag narinig mo talaga. And, importante na meron kang second hand watch. Kasi dun mo ma-measure siya in full minute. I-measure mo siya in full minute, milan talaga. Kasi sometimes when you use the pulse oximeter, like I have one here. So, I have a pulse oximeter here. Ganito yung tsura ng pulse oximeter. So, we are using a pulse oximeter actually in the hospital. So, para mas easy ma-measure yung heart rate, hindi ka na gagamit ng hindi mo na siya ma-measure manually. Kaya lang, minsan kasi, hindi siya accurate. Especially pag may mga pasyente ka nga na mga cardio cases na may mga problema sa synapses ng puso, alam mo yun. So, hindi siya masyado accurate pagdating sa mga ganon. So, you have to do it like really manual check their beat, their pulse rate, and the heart rate. Yan. So, yan lang. Tapos, we also have the pain rating scale. Kasi, di ba, kasama yan sa vital signs, yung scale ng kanilang pain rating scale. So, we have different kind of pain rating scale. So, we have the numerical. So, you will gonna ask the patient like, from 0 to 10, 0, walang pain, 10, pinakamataas na pain. Nasaan ka? Nasaan yung pakiramdam mo na yung rating mo sa sakit na nararamdaman mo. And also, we have the Wong-Baker's phase. So, dito makikita yung mga facial grimace ng tao kung gaano kasakit nararamdaman nilang pain. So, yan. Mas-score mo siya, yung pain level nila. Kasi, syempre, pag nagpipain yung pasyente, hindi mo naman kasi masasabi na, ay, arte lang yan. Because, they are the one who's nakakaramdam nun. Hindi tayo. So, they really have the right to say na painful talaga kung nararamdaman talaga nilang may pain. And, trivia lang, may mga pulse oximeter na merong respiration rate too. Like this one that I have. So, meron siyang measurement ng RR, which is really, really cool. You see? I'm gonna show it to you. Para tayong vlogger talaga. Anyway. Wala pa. Papakita ka lang sa inyo. Kasi natutuwa lang ako. Wala yata akong RR. Wala yata akong respiratory rate. Ayun! It's 21. So, I have 100% auto saturation. That's amazing. Anyway, yeah. Now we go to the assessment of nutritional status examination. Usually, ito usually ginagamit yata to sa mga rural health, sa mga clinic, sa mga bata, if they're gonna measure the nutritional status of the child, or sometimes, mga clinical nutritionists, usually they use this, nutritional assessment. Pero as also, we should also know how to use it. So, we have the skin fold caliper to measure skin fold. Para i-measure yung skin fold kung gaano kataba yung kanilang mga tiyan, para ma-measure nila yung subcutaneous tissue. And also, we have the flexible tape measure to measure mid-arm circumference, or sometimes we usually use to measure it the abdominal circumference. Depende, kasi we usually have like patient with ascites na medyo lumalaki yung tiyan nila, and sometimes the doctor ordered to have like abdominal girth measurement once a day. So it will be like early in the morning when patient or when the client is not yet taking his or her breakfast. So you should measure it. Sometimes they also have like order like you have to weigh the patient every day. So dapat lagi yan before breakfast early in the morning para accurate. At saka pare-pareho yung oras kung possible pare-pareho sana yung oras every day para at least talagang accurate yung measurement natin. Kung may pagbabago ba sa weight niya. Kasi pag may ascitic fluid yung pasyente, yung tinitingnan kasi nila kung dumadami ba or kumukonti. So, ganun yung kaya nagpapameasure sila ng ganun. So, also, I'm gonna say expo. We also use surgical marking para ma-mark natin kung saan. They usually call it skin marking pen. So, ito parang siya, water resistance. Ginagamit namin to usually kapag may yung pasyente may sugat, or may hematoma, may blister. Susukat namin yun, then, kung kailan siya, para malaman namin kung lumalaki ba, o lumiliit, o dumadami. So, yan. Parang, siya, ima-mark mo. So, sa nutritional status, ganun din. Gagamitin mo to mark or measure para sukatin, or lagyan ng, para ma-mark mo yung mga measurement na nakuha mo. So, yan. And also, we have this one for nutritional status. We use the platform scale with height attachment to measure height and weight. So, dati ito talaga, old school, yung ginagamit talaga sa mga rural health, sa hospital namin, we're using the same kind, but it was already electronic. May battery na siya. Battery operated na siya. Pero ganun pa rin. Ganun pa rin kalaki. Tapos, meron lang siyang, pwede mo siya itaas yung kanyang ruler para ma-measure yung iyong height. Pero yung weighing scale niya, na siya, what do you call this? Electronic na. Alam mo yun, naka-digital na measurement. Hindi na yung, naalis-alisin mo pa yung bar na yan para na-measure mo siya ng tama. For the skin, hair, and nail examination, we have examination light. We need it. Kailangan mo yan para ma-measure talaga, makita mo talaga mabuti. And we also have the pen light. It was really required when you're a student nurse, you are really required to use the pen light. Kasi mina-measure din yan minsan. Ginagamit din yan para makita yung pupil, para measure yung dilation ng pupil. And then, we also needed some metric ruler to measure the size of the skin lesion. Usually, kapag meron kang surgical marking na pen, may kasama na yun minsan na ruler. Yan. So, parang ma-measure mo na rin. And also, we had a magnifying glass to enlarge the visibility of the lesion. So, yan. Minsan hindi masyadong ginagamit yan. Pero dito, syempre, ideal to. They use magnifying glass para makita mo talaga kung ano yung itsura ng lesions, kung anong meron dun, kung may nana ba, kung may mga something maliliit na bagay, o may mga di rin alam kung ano, kaya para makita talaga mabuti. And also mirror for client's self-examination of the skin, para yung client mismo yung sasabi kung ano talaga yung assessment niya dun, kung pareho ba kayo. And then Hood's light to test for fungus. So I have searched for it kasi di pa ako nakakita nito actually. So para lang siyang para siyang lamp parang ganito. pang selfie, pang vlogger. Yan, ganyan. Pero, yung kanya kasi parang UV light. Para makita mo kung may fungus. Tapos, parang yung fungus umiilaw. Kunyari, nasa skin may sugat ka. And then, makikita dun kung merong, what do you call this? Umiilaw. Parang nagla-light yung fungus. Para malaman kung fungal infection ba yun. Ayan. So, we have also here for the skin and hair and nail examination, we have the Braden scale for predicting pressure score raise. So, dito, you remember the assessment that you have already answered? Di ba may Braden scale doon? Doon mo answeran dyan. Kung ano, kung sa sensory perception, sa moisture, activity, may ano mo naman yan, the things that apply for your client, imamark mo lang. And then, you will get that may score yan na naka-indicate. So, pa-plus mo lang hanggang sa makita mo pag higher than 18 to 20, ganyan, syempre, mas high risk. We also have the pressure ulcer scale for healing. Push ang tawag. Sa amin, ang tawag, pressure injury. I forgot the name. Pero, nagme-measure kami every 3 days. Kunyari kapag ang patient mayroong what they call this, pressure injury. So, that's it. And also, for the head and neck. Sorry ha, I'm wearing, napapagod ako kasi I'm just only here on my bed. Kaya, pabago-bago ako ng position. For the head and neck examination, you use the step to auscultate the thyroid. And also, a small cup of water to help the client swallow during examination of the thyroid gland. Makita mo kung okay ba yung pag-swallow niya. Ganun. And also, for the eye examination, we have the pen light to test pupillary constriction. And also, the Snellen E-chart. This was the famous chart that we know na pinameasure kung for distant vision. Sometimes yung iba magdadaya lalapitan mo at salapin nila kung saan yung normal. And then they will memorize the letter. And then when they were asked, nakikita niyo ba? Nakita na. Then, sige nga, banggitin mo. Then, pero this one is a good measurement kung talagang meron kang problema sa vision. Newspaper para to test near vision. Okay? Next one, we have the equipment for eye examination. So, we have the opaque card to test for strabismus para ma-check kung meron kang panuduling. Ophthalmoscope to view the red reflex and to examine the retina of the eye. Usually, yung mga bit-bit ito, yung mga ophthalmologist fellow, meron din sila na. Okay, so we go to the ear examination. So, pag ikaw ENT fellow, yung mga sa ear, nose and throat na fellow, may bagyan sila, tas ganun yung mga nakalagay. Meron silang mga pang-measure kung parang pang-test ng tenga, pang-test ng throat, syempre kasi ganun talaga yung kanilang kaya meron silang bag. Tuning fork to test for bone and air conduction of sound. So, ginagamit nila yan. And then, they also have the otoscope to view the ear canal and tympanic membrane. And also for the mouth, throat, nose, and sinus examination, we have the pen light to provide light to view the mouth and throat and to trans-illuminate the sinuses. 4x4-inch small gauze pad to grasp the tongue to examine the mouth. And we have the famous tongue depressor, okay, to depress the tongue, to view the throat, to check the looseness of the teeth, to view cheeks and cheek strength, and check strength of tongue. So, yan yung mga purpose ng tongue depressor. Sometimes we use, minsan yung tongue depressor ginagamit na pang splint kapag yung IV line nandito sa mga fingers na side. Kaya nandito. Para at least may splint siya. Kasi lang naman gamitan mo ng malaking splint. Kasi ginagamit namin yung tongue depressor just to make support to the IV side. Kasi minsan pag wala talagang makuha dito na IV line, minsan nandito na sa daliri. Ayan. So, we use sometimes the tongue depressor. So, maraming purpose ng tongue depressor. And also, they also have the otoscope with wide tip attachment to view the internal part of the nose. Okay, now we have the thoracic and lung examination. Stethoscope Napaka-importante talaga. Diaphragm to auscultate the breath sounds. Metric ruler and skin marking pen to measure the diaphragmatic excursion. And also for the heart and neck vessel examination, we have the stet, 2 metric ruler to measure jugular venous pressure. For peripheral vascular examination, we have the sphygmomanometer and stethoscope to measure blood pressure and auscultate vascular sound. And we also have the measuring tape, the famous measuring tape. So, dapat mayroon ka rin ganan. Pero usually, kung may mga measurement, minsan dapat yung client meron sila. So, minsan yung-orderan namin sila ng isa para sila lang yung gagamit nun. Kasi, syempre, you're touching the skin of the patient. So, dapat personal nilang gamit yun. And to the other patient, iba rin dapat. Tuning fork to detect vibratory sensation. And Doppler ultrasound device and conductivity to detect pressure and weak pulses that not can be easily heard by the stethoscope. So, yan. And also, for abdominal examination, we have stethoscope na naman. Sabi ko sa'yo talagang sikat to si Stet Flexible metric measuring tape and skin marking pen to measure the size and mark the area of percussion of organs. 2 small pillow to place underneath and head to promote relaxation of abdomen. Kaya nag-check sila, nag-percuss sila ng abdomen. Yan, they usually use that. Flexible metric measuring tape to measure the size of extremities. Ito naman nasa musculoskeletal. And goniometer to measure the degree of flexion and extension of joints. Ito makita nyo usually sa mga ortho ward. For neurologic examination, ito pa yung mga fellow, mga doctor na usually may bag kasi nandito yung mga gamit nila. So, yung mga neurology fellow, like cotton tip applicator, ginagamit sila na to put salt or sugar on tongue to test the taste. And sometimes they also have newspaper to test for near vision, and they all have the ophthalmoscope. And also this one, I don't know if you, I think you have, nakakita na rin kayo dito, reflex hammer, para i-test yung deep tendon reflex mo, yung tuhod mo, tapos yung paa mo, tumisipa. Object to feel such a coin or keys to test for stereognosis or ability to recognize object by touch. And also the flexible metric measuring tape. So ito, ang dami sa neurology. Ito pa, meron pa sila dapat na cotton ball or any sharp object para i-test yung for light, sharp, and dull touch 2-point discrimination. Kung mali-discriminate man ng patient na masakit ba, malambot ba yan. So, para alam nila. Para matest nila. Sometimes, they have also substances to smell and taste to test for the smell and taste perception ng patient. They have salt, sugar, they have soap, and some coffee ground. Snellang e-chart. Yan, they also have that. Pen light. Tongue depressor to test for the rise of uvula and gag reflex. So, may-measure din nila yan. And tuning fork to test for vibratory sensation. And also, pag nag-check tayo ng male genitalia and female genitalia or rectum, dapat meron tayong gloves. Dapat nga double gloves ka. And also, some water-soluble lubricant or KY jelly to promote comfort per client para hindi sila masyadong masaktan kapag kina-check nyo yung mga area na yan. Pen light for scrotal examination para malaman nyo kung may descended ba or yung scrotum ng patient. Specimen card for occult blood. So, yan. Merong mga ganan din para mo makita mo. Vaginal speculum for female genitalia pala. Male genitalia yung kanina. Ngayon, female genitalia and rectum examination, we have the vaginal speculum and water-soluble lubricant to inspect the cervix through the dilatation of vaginal canal. So, we have this bifid spatula, endocervical broom to obtain endocervical swab and cervical scrape and vaginal pulse sample. So, yan, magamit din tayo once nakapag-assist ako ng ultrasound ng cervix. So, they also have that kind of thing, and then, yun, ipapasok talaga sa cervix para makita kung ano doon ang problema. Large swab for vaginal examination. So, yan. Yung glasses ko parang cotton buds na mahaba. Ganun na itsura niya. Kaya nag-COVID test kayo, ganun din pinapasok sa ilong nyo. And then sa throat. Now, we also have, for female genitalia and rectum examination, we have the liquid puff medium. So, dito ilalagay yung nakuha. Diba? Ipapasok nila yan. Tapos, mag-smear sila. pH paper para malaman kung acidic or alkaline yung environment ng ano mo, or feminine napkins. Syempre, pag may mga bleeding yung client, at least they should have at least like that an extra. Adequate lighting is used to best. Ano dapat yung adequate lighting natin? Syempre, best pa rin yung sunlight. Pero, kapag available yun. Pag if not, so we have to use the lamp. However, good overhead lighting is sufficient. A portable lamp is helpful for illuminating the skin, for viewing shadows and contours, and also firm examination table or bed at height that prevents stooping. A roll-up stool may be useful when it is necessary for the examiner to sit for parts of the assessment. So, a bedside table or tray to hold the equipment para mas malapit sa iyo, mas malapit mong maabot. Okay, so the nurse provide privacy and asked Mrs. Gutierrez to empty her bladder and put on examination gun. So, minsan pinapa-empty na natin yung bladder niya para hindi na hassle na, mamaya, nakakalagitnaan ka ng examination mo. Ay, naihiya ako, miss. Pwede ba lumabas muna ako? So, much better na napaihi mo na agad si patient para wala ng distraction. So, preparing oneself. As a beginning examiner, it is helpful to assess your own feeling and anxieties before examining the client. So, anxieties easily conveyed to the client who may already feel uneasy and self-conscious. Siyempre, yung mga client natin, mga self-conscious na sila kasi kailangan nilang, kasi kung mag-check pa tayo ng mga private parts, so, siyempre sila din, uneasy rin for them yun. So, achieve self-confidence in performing a physical assessment by practicing the techniques on a classmate, friend, or relative. So, pwede naman kayo mag-practice di ba, pwede kayo mag-duty, pwede kayo mag-practice not gamit your kaibigan or asking your friend, classmate, relative na nagpe-pretend to be your client para mag-practice mo, para pag nasa actual client ka na, alam mo na kung paano. And then another important aspect on preparing yourself for the physical assessment is preventing the transmission of infectious agent, kasi kailangan mo talagang protektahan din yung sarili mo. Okay, so ayan, so may mga precautions na yun na dapat alamin according sa Center for Disease Control and Prevention. So first thing first, you have to, we have here, the nurse reviewed the data on Mrs. Gutierrez and reviewed her knowledge of diabetes, anorexia, and insomnia to explore possible physical findings that may be correlated with this condition. So first thing first, you have to wash your hands before beginning the examination. So immediately after accidental direct contact of the blood or other body fluids, or after completing the physical examination, or after removing your gloves. So you always have to wash your hands. If possible, wash your hands in the examining room in front of the client, so they will know that you are already clean, and this assures your client that you are concerned about his or her safety. And also, you always have to wear gloves if there is a chance that you will come in contact with blood or other body fluids. In addition, wear gloves if you have an open cut or skin abrasion. So, importante na may gloves ka talaga. And if the client has an open wound or weeping cut, if you are collecting body fluids, mutants, if you are handling some contaminated surfaces, and when you are performing examination of the mouth, open wound, genitalia, vagina, or rectum. So, you have to also to change gloves when moving from a contaminated to clean body site. Alam nga naman yun ang ginamit mo sa contaminate, gagamitin mo rin sa clean. So, you have to change also. And now, if a pin or other sharp objects is used to assess sensory perception, discard the pin and use a new one for your next client. So, dapat talaga, kung anong ginagawa sa pasyente mo, dilinisin mo bago mo gamitin sa iba. Or, kapag disposable naman, huwag mo nang gamitin. Okay? Kung disposable din naman. So, ibig sabihin nun, isang gamit lang. Wear a mask